My name's Lisa Marie, independent midwife registered in the UK. Today we're going to have a look through what is normal for a postpartum recovering mother. So, first and foremost, I'll talk about the emotional well-being of a birthing person. So, after birth, there's a huge fluctuation in hormones, and it's really common for people to experience a period of what's known as the baby blues. And in reality, what this is just a dip in the hormones around about 3 to 5 days after birth, and it tends to coincide with when mother's milk is coming in as well. It can normally leave emotional waves and tends to clear up relatively quickly. Postnatal depression, on the other hand, can occur at any point in the postpartum period and tends to be longer lasting. It's a different experience for each person. You're going to learn lots about this in this unit as well. The physical recovery from birth is very variable from woman to woman, from person to person. Pelvic floor exercises are one of the key components of the physical recovery from birth, whether a woman has had a vaginal birth or a cesarean section. It's really common for women to experience a small amount of incontinence issues after birth, usually urinary, very occasionally some fecal incontinence. Pelvic floor exercises will really help the road to recovery here. However, if there is any concern at all, then it's really important that they speak to a midwife, or even potentially even a GP or a women's health physio. Some people have sutures, so that's stitches in the vaginal area, so in the perineum or in the labia, or sometimes occasionally around the urethra after birth. This can obviously cause quite a lot of discomfort for some people. So they will have had information and guidance from their midwife about how to care for their perineal area, and just gentle reminders and supporting the woman with this. It's quite common for people to have constipation following birth. Often the bowels don't actually activate for 2, 3, 4 or 5 days after baby has been born. Simple ways to support that would be to leave stools and magazines in the bathroom so that the feet can be raised a little bit and a more physiological angle of the pelvis can support that initial bowel motion following birth. And dietary issues as well really contribute to how a person experiences constipation and bowel movements after birth. Hemorrhoids are also another consideration, which may have developed during pregnancy, but may also be directly as a result of the active pushing phase of birth. Again, support and guidance can be sought from a midwife if there is any concerns, and over-the-counter remedies are usually quite appropriate to use. It can be quite common for a birthing person to experience some intense stinging or burning sensations when they pass urine, which are often associated with any tissue separation that they have had during the birth process. This can usually be remedied with a jug of warm water, tepid water, kept beside the bathroom toilet, and then just poured down gently as the person is passing urine or urinating in the shower or the bath, and ensuring that hydration levels are kept up really well to keep the urine as dilute as possible. As you can see, diet and hydration are really, really important in helping the physiological recovery from birth. For a person who's had a caesarean section, the recovery process of their scar is very variable. Often on day 1 to 2, the wound covering is removed, and then occasionally there are some staples or a big long suture that needs to be removed from the wound on day 5. The wound needs to be cared for with the guidance that has been given by the midwife or the doctor, and observing for any signs of infection is really important. So any leaking, any pus from the wound, any red or swollen areas around the wound, and any signs of systemic infection, such as a fever. The bleeding after a birth is known as lochia. This is very individual for each woman. Often lochia will be heavy for fresh red heavy for around about a week to 2 weeks, and then tends to tail off after that into a browny colour, a bit more watery, a bit lighter in colour, pinkish, until it starts to disappear. Women can have this lochia present anything from around a week up to 6 months at the most extreme level. Variation levels are quite normal. The things to be observant of are any sudden heavy bleeding, soaking through a pad within an hour, for example, or any big clots. Few clots are quite normal, but big clots that are usually larger than a 50p piece, so that sort of size, could potentially be something to be concerned about and to discuss with a midwife. It can be quite common for the lochia to settle down and then to suddenly start up again as the woman starts moving around and introducing some more activity into her life. It can be an indication just to steady things down a little bit as well. A heavier lochia can often coincide with breastfeeding, as breastfeeding causes some uterine contractions, which force some additional bleeding out. This is quite a normal process. Breastfeeding can also cause some after pains, as they are known as. So this is that contraction of the uterus. That process can cause some cramping pains. Some women describe it as period pains. Some women describe it as very mild contractions, like when they were in labour. This is quite a normal process. Engorgement is quite a common thing that can occur. So as the breast milk comes in, then this fills up the breasts, and that can cause quite an intense sensation, known as engorgement. This is something that you are going to really learn more about in the breastfeeding unit. So again, it is something that is quite normal and can be symptoms of it can be relieved as well. You will also learn about what is considered to not be normal around engorgement and breastfeeding. In terms of longer term recovery from birth, things to be aware of are something called diastasis recti. So this is the separation of the stomach muscles, which occurs in pregnancy as a normal part of pregnancy to allow for room for the baby to grow and develop. Those muscles should return together usually by around 6 weeks, give or take a little bit, and normally with about 2 fingers gap between them at the most. If there's any more than 2 fingers gap between those muscles, then that could be something that a physiotherapist needs to support. Again, this process of diastasis recti, the muscles returning together, is normal. Just seek some support. if there's any concern that this is not a normal recovery process. Further down the line, you might notice that hair starts to fall from the head. Again, this is quite a normal thing. This is just associated with an increase in hair through pregnancy, and then those hair ends die postnatally, normally about 3 to 6 months, and wash away, and then you return to the normal head of hair. Sweating is another common occurrence. Change in a person's awareness of their scent, their body odour, the changing in hormone levels can cause significant changes in this too, and it will settle down, and it is something that's quite normal. If there are any concerns about anything at all with regards to the recovering postpartum body, it's really, really important to speak to a midwife or to speak to a GP or a women's health physio to seek the right support that is required. If of course there is anything that crops up that is absolutely urgent, then do not hesitate to dial 999 or 111 if you're here in the UK, either of those numbers, or call an emergency medical team.